Heard It Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Heard It Health. I'm Marissa Plesha, reporter from MedCity News. I'm here with Dr. Mark Pratt, Chief Medical Officer of Altera Digital Health, a healthcare IT company supporting clinicians. Thank you so much for joining us.
Absolutely.
So Altera has often said that digital health should make healthcare easier, not harder. How is Altera supporting that?
Yeah, so I think one of the biggest issues that we face, even as clinicians, is just the usability of the software and the time it takes to document and do your everyday tasks that you need to do just to get through the day. And so I think we're seeing a lot of emerging technology, even at this conference, talking about how to take and do natural language processing and artificial intelligence to really help produce documentation for physicians. And so anything that's offloading activities that will allow the physician to spend more time with their patient directly instead of inside the EHR doing documentation and things like that is going to help the clinician experience for sure. So we're looking at a lot of those things. I think in the revenue cycle area too, we're doing a lot of research on how robotic process automation can do tasks inside of claims management and the revenue cycle areas. And so I think those are two of the big areas that we're seeing a lot of interest in.
Yeah, and now you're an expert in rural healthcare. How can technology be leveraged to really improve rural health?
Yeah, so one of our solutions is really good at aggregating data across multiple EHRs. It's called DB Motion. And so we see a lot of need for that in these rural communities where they're a long distance from a tertiary care center, but they need access to that information about the patient. So that tertiary care center is sending that patient back to the community when they're finished with their hospitalization. And so a lot of times, even today, they're having difficulty getting that documentation, lab results. That's very difficult. And so if we can enable the technology to be able to easily present that information to the clinician at the point of care, I think that's really helped a lot.
That's great. And so your organization really recently launched a new partnership with Harris Affinity. Can you tell us about that partnership and what it looks like?
So, if you look at the statistics, over half of U.S. hospitals have lost money this last year. And so anything that they can do to improve revenue capture or reduce cost is top of mind for every CFO in every hospital. And so Harris Affinity is great at cost accounting and using technology to really look at the cost of providing care and how that can be optimized. But that also speaks to Harris in general. We have a lot of companies inside the Harris healthcare organizations that we're starting to take advantage of inside the EHRs. And those partnerships have become really valuable to us.
Yeah, that's great. Well, thank you so much for joining us, Mark. I hope you enjoy the rest of the conference.
Thank you so much.